It is day 2 of top surgery, post-op top surgery. So this video is basically going to be a video about drains. Right now I'm going to show you, I'm by myself, so I don't have anybody that's helping me with drains. So yesterday on a scale of 1 to 10, I was probably like a 1, if that. And today was more, I would say 3, it wasn't unbearable. I've also been taking my meds I have an alarm going off like every 6 hours to take something, whether it's a Percocet or Tylenol. I'm switching on and off between Tylenol and Percs. And then between that, sometimes I'm taking a Xanax to sleep, and then I have edibles, which I'm taking sporadically. The edibles actually, it's not that bad sleeping on your back when you're hot. If you can get edibles, I don't recommend smoking because I was told not to smoke. I don't like smoking anyways. But so far, as far as pain management, I would say the edibles have been the best sleep, if you will. Being on my back hasn't been a problem. So today though, on a scale of 1 to 10, I would say my pain with the pain pills and everything has been about a 3. I feel much more, I don't know if you can see, I feel much more swollen. Like yesterday, I felt like the binder was like almost too loose. Today, I feel a little bit more swollen, but I'm not bleeding anywhere. This side is draining a little bit more. So with that said, what I'm gonna do now, I'm gonna wash my hands, and then I'm gonna figure out an angle to show you how I'm gonna empty the drain. So if you don't like watching blood or any of that, you should just fucking leave. But if you're by yourself, and you don't have anyone taking care of you, welcome to the solo top surgery drain show. Dun, 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 dun. Got some alcohol pads. The drains are hooked here. When I'm standing, because I am working, I don't have to work them off. But when I'm standing, I'll put them lower to like just stretch out the tube and just have it like dangle for a little bit while I'm standing, like clip to my pants. I'm going to open up one of the alcohol pads, get that ready. This is the little cup, which is primarily just used to measure. So can we see that? Cup empty. Basically, it's pretty simple. This part is supposed to remain in. I don't have that much fluid, but we're gonna pop the top here. You see, compare these two. So by suctioning out, this one's not too bad actually. And then I drained at like 4 a.m. So I consider that morning. This would be bedtime, and it's about 6:30. So from this point so this is how much fluid is in there. Can you see that? The first line, where my finger is 20 milliliters. So I'm gonna guesstimate that this is it's definitely not half. It's probably, I would say about 4 milliliters. And I'm gonna clean all of this around here because this shit goes right into your fucking body. This side is pretty good. This side's pretty clean. Get rid of this. You're gonna squeeze, right? Because this works on suction. Squeeze as much as possible, and then we're gonna recap. And we'll drain again tomorrow morning. And it should stay suctioned, see? And continue to pull out fluid. Just reclip up here, and we're gonna do, that one's all set for now. Good. Dump it in the toilet. This side has, like, if you saw my story, or if you saw the first video, I had a whole mishap with driving. I wasn't supposed to, but there's a whole bunch of shit that happened. I don't know if I fucked something up real bad. I'll find out Monday, but this side has a little bit more fluid, I think. If I had someone, what would I want them to do, you ask? Make me sandwiches. Bring me pain meds. 8. And yesterday for that side, we were at like 12. So we're definitely going down, which is good. So you see how this side though, If you look at the tube on this side, I can't really like take this off, but like this one just has a little bit more fluid in the tube compared to this side is more clear, right? So, I mean, they did say that swelling or the drainage could be different on either side, so I'm not too concerned. I don't have any pain, so it is what it is. This is the part that popped out yesterday because I was fucking around. Basically trying to clean out the tube. So you got even a little more there. And then we'll go up here and drain this fluid. Less than 10. Alright, we're reattached. Everything's looking alright to me. I mean, I'm no fucking doctor, but I'm icing also. Other than that, that's me doing the drains. So I have this little sheet here, which confused me because like, it says right side, left side, right? But like, do they mean my right or like your right? If you're by yourself, doing drains isn't that difficult. Like I could feel where this drain goes in, like right here. It's like right here, boom. This right here is super sensitive. This side is right, I could feel it right there. But I definitely am gonna say this side's a little bit more painful. And I think it's because of my adventure yesterday, which if you missed day one, by all means, go listen to that adventure. Other than that, I feel fine. So yeah, if you're by yourself, don't worry about it. It's not that hard. If somebody's helping you, you know, I wash my hands and I use hand sanitizer, but like if somebody else was helping me, and I'm not saying that I shouldn't be wearing gloves, but I would have them wear gloves because it's icky for them too. So I don't know if I'll have anything else to say before the post-op appointment, but I just wanted to show you my process for doing the drain. We're done.